Hello everyone, I am Dr.Shalini Singh. I'm your fertility consultant from 9M Ankura Fertility. So today we are going to discuss various fertility treatment options for both men and women. If a couple is married and they're having unprotected intercourse and they're not able to conceive from last 1 year, it's the time for them to get evaluated. So any couple who has infertility, that means they have not conceived even after 1 year of trying, can have various causes for infertility. So the first step in treatment for infertility is evaluation. Evaluation of both men and women. And when a woman approaches the doctor, first step we do is we take a good history and to know about her menstrual cycle and her past medical history. And a scan will be done to see your uterus and your ovaries. And some blood tests, hormone tests to know her basic hormone profile. For men, they may go for a simple test like semen analysis, which needs at least 5 days of abstinence. So once your basic evaluation is done and we know that there is no other problem and the couple is young in their 20s, they can still try naturally for around 6 to 1 year. In spite of everything being normal, they are not able to conceive, then your fertility treatment may be started by your doctor. So there are various fertility treatment options available for the couple depending upon the cause of infertility. If there is no other cause infertility, simple treatment like ovulation induction can be started for the patient. In ovulation induction, we just give you medication to induce ovulation and track your egg. And when your egg is around 19 to 20 millimeter and your endometrium is good, doctor will give you a trigger injection for the egg rupture and you can have a timed intercourse and this may help you to conceive. Such treatment like ovulation induction has a success rate of around 10 to 15%, means out of 10 patients taking this treatment, 1 patient will conceive in 1 month. This treatment can be offered for 3 to 6 cycles for a patient. In between, we might need to do a tubal testing. A tubal testing can be done by laparoscopy or through a simple test called HSG. Second treatment option is IUI. In spite of trying naturally with ovulation induction, some patients may not conceive. In those patients, we might have to go for intrauterine insemination. Intrauterine insemination may be directly advised to the patients who have sperm motility issues and unexplained infertility. IUI is a simple technique where sperms are prepared with the help of a centrifuge and sperms are selected on the basis of motility. So both ovulation induction and IUI are natural methods of pregnancy. In these treatments, sperm and egg selection is done by the nature and success rate for IUI can be up to 15 to 20%. So we can give IUI treatment for up to 3 to 4 cycles for the patient, and in spite of these treatment, if the patient fails to conceive, it's better to step up the treatment. I would strongly recommend patients not to go for IUI just because they don't want to go for IVF. Third most important and the advanced treatment for infertility is in vitro fertilization or IVF, or commonly called as test tube baby. In this treatment, egg is taken out from the body of the female and the sperm is fertilized with the egg in the lab. The egg is grown for around 3 to 5 days, and when the embryo develops, the embryo is put inside the uterus. And then the embryo implants in the uterus and the pregnancy happens. Though it may appear simple, but it's a very effective treatment with success rate depending upon 40 to 50% and can go up to 60 to 70% in a patient who are young. Other treatment option like diagnostic hysterolaparoscopy is also offered to the patient. In modern day infertility practice, diagnostic hysterolaparoscopy has very limited indications. In couple who are young in their 20s with semen analysis being normal, other female investigations being normal and not able to conceive after few cycles of IUI and ovulation induction, diagnostic hysterolaparoscopy offers an advantage of knowing that why fertilization and implantation is not happening. But if the couple is above 30 and if there is a motility issue in the sperms and there is a tubal problem in the female and the AMH is low and the egg quality is poor, such patient, instead of going for laparoscopy, should go for IVF.